What is hepatitis? Hepatitis is an inflammation of the liver that can be caused by various factors, including viral infection, alcohol or drug abuse, autoimmune conditions, and certain medications or toxins. Hepatitis is actually a viral infection which can be easily caused the viral infections in the liver. Those people who are immunodeficient, or those people who have the diabetes, or those people who are taking the medications for a long period of time, they most have the higher chance of getting the hepatitis infection. And the hepatitis infection, as you can see in this figure, it is mainly effect on the liver. The next slide is about the symptoms of hepatitis. The symptoms of hepatitis can vary depending on the type of hepatitis. There is a different type of hepatitis. We can discuss it in the next slide. Firstly, we should know about the symptoms of the hepatitis. The mainly symptoms which are included in it is the fatigue, jaundice, loss of appetite, nausea and vomiting, fever, muscle pain, enlarged liver or spleen, dark urine and pale stool. Dark urine and pale stool and enlarged liver or spleen, these two are the specific symptoms which are commonly relevant to the hepatitis. If the patient who has large fever or spleen, or the person who suffered from the dark urine and having a pale stool, the healthcare worker always recommend firstly about the hepatitis test. The next slide is about the hepatitis virus. As you can see in this figure, there is a different type of viruses with a different structures representing the different hepatitis virus types. As you can see, there is a hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D or hepatitis E viruses. So there is a different types of the structures are shown. As you can see, there is a hepatitis C virus is a glycoprotein, there is a genetic material, and there is a lipid enveloped virus. And then in the hepatitis D virus, there is a glycoproteins also, there is also a lipid envelope, and there is a genetic material in it. While in the hepatitis B viruses, there is also a nucleocapsid which are going to be different in differ in its shapes, and the commons are the glycoproteins and the lipid envelope. And in the hepatitis A viruses and in the hepatitis E viruses, there is this is not the enveloped one, and the genetic materials are completely shown in both the viruses in the hepatitis A and E, and there is no glycoprotein on it. So this is about the hepatitis A, B, C, D and E viruses. But there is a question. You can see there is a hepatitis A and the hepatitis E has no spike protein. Then how it's going to be attached to the host cell? So the answer is that the hepatitis A and the hepatitis E virus do not possess a spike protein like some other viruses such as the COVID-19, but there is some other mechanism which uses by these two types of viruses. Like in the hepatitis A virus, it can enter into the host cell by the receptor mediated endocytosis process, and it can going to be used the receptor like the HAV cellular receptor or the CD55, which are mostly found on the surface of the hepatocyte, means liver cells. After binding to its host receptor, this virus is taken up by the host cell in the vesicle, and the RNA and the viral RNA of its genetic material is going to be released and causing the infection. Likewise, in the hepatitis E virus, it also be entered through the receptor mediated endocytosis. It doesn't mean if these two viruses don't have glycoproteins or the spike proteins, it can't cause infection in humans. These two viruses are also infectious one. They both cause infection in human body, but the entrance process is different from the hepatitis C, D, E, hepatitis C, D and V viruses. So the hepatitis E virus also use the mechanism which is the receptor mediated endocytosis. This is the mechanism which is used by these hepatitis A and hepatitis E virus in order to get into the cells. After it entrance, the hepatitis E virus is also cause infections in the cells by releasing its viral RNA. So these both viruses are non-enveloped viruses, mean they lack an outer lipid membrane, which are mostly found in the other viruses like the COVID-19. So this is about the hepatitis virus types. The next slide is about the structure of the hepatitis virus. As you can see, there is the envelope. This is the lipid envelope. Then there is the glycoproteins. Glycoproteins are help the virus to enter into the host cells, and after that there is the capsid, which are enclosed in the lipid envelope, and inside the capsid there is the genetic material of the viruses, and the hepatitis genetic material is mainly composed of the single stranded RNA, which is positive sense strand. And after that you can see there is a glycoprotein, and the E1 E2 glycoproteins are mainly used in it. So this is the structure of the hepatitis virus. After that there is the next slide, which is about the transmission. Either the infection of hepatitis is going to be acute or chronic, and what's the treatment of the different types of viruses, hepatitis viruses. So in the hepatitis A, the transmission is usually spread through the contaminated food or water, or to the close contact with the infected person, while hepatitis B is easily transmitted through the blood, semen and other body fluids. Hepatitis C virus is most commonly are found, which are going to be easily transmitted from one person to another, and it is one of the most in the pandemics. It is mainly spread through the infected blood, such as the sharing the needles during drug use or improper sterilization medical equipment. So it is spread through this mechanism. So this is about the transmission, and the next one is about the acute. Either these hepatitis viruses are going to be acute or chronic. Hepatitis A virus is mainly an acute infection, and most of the peoples are going to be recovered easily. Hepatitis B virus is either be acute, or if it not treated, then it leads to the chronic infections. Hepatitis C virus is mainly a chronic infection. If it is left untreated, it can lead to the liver cirrhosis, liver failure and liver cancer. So this, as we all know that the hepatitis C viruses, hepatitis B and hepatitis A viruses, these are mostly use the host receptor of hepatocytes, so that's why it's mainly affect the liver. And if the hepatitis C is untreated, then it leads to the liver cancer. What's the treatment? If the patient is suffer from the hepatitis A, B or C, then what's about the treatment? Hepatitis A virus, there is a no specific antiviral treatment. Supportive care, rest, maintaining dehydrations are mostly recommended. In the hepatitis B virus, the antiviral medications are available to suppress the viral replication and reduce the liver inflammation. Means those medicines which are involved in the antiviral medication of the hepatitis virus mostly use its target to block the replication process of the virus in host cells. This is one of the major point you can always remember this, what the medication do and what the medication are going to target at the which step of the virus. Hepatitis C virus is mainly are available, medications are mainly available that can cure most cases of the hepatitis C. And now there is also a vaccination. Vaccination is one of the most effective way in order to prevent from this type of chronic infectious diseases. So this is about the transmission, acute, chronic, either the infection is going to be acute or chronic, and what's about its treatment. The next slide, as you can see in every infectious slide, in every infectious course part, I always add a outbreak slides. This slide is majorly relevant. This slide is majorly relevant in order to explain how the infection is going to be spread in all over the world. So the hepatitis A outbreaks, I'm going to discuss about the hepatitis A outbreaks. It is one of the virus which is acute and easily treated, but its transmission rate is highly variable and it's highly diverse. So it's about in 2016, 37 states have publicly reported 44,657 cases, 61% hospitalization, and 417 deaths. So it's look like the high mortality rate. And after that, how we can prevent from this virus by using the proper vaccination time, by treating the patients with specific care. So the people who use drugs, people experienced homelessness, people who have sex, men who have sex with men, people who are currently or were recently incarcerated, people with chronically liver disease, these are those who are easily suffered from the hepatitis A viruses. So the Hepa A vaccine, this is the one dose vaccine, this is the booster vaccine which are available in order to prevent from the hepatitis A viruses. 95 protections, it's a very high efficacy rate, so it's a very good one to prevent ourselves from the vaccination doses. So this is about the vaccine. This is about the outbreaks of the hepatitis A viruses. How to diagnose the hepatitis virus? Diagnosis is one of the major part. It's one of the highly it is one of the highly diverse part of every infection, of every healthcare content. So we are going to discuss about the hepatitis virus diagnosis. The diagnosis of the hepatitis virus involves several steps to identify the specific type of hepatitis and determine the severity of the infection. Here are some common methods used to diagnose the hepatitis: medical history and physical examination, blood test such as there is a three blood tests which are going to be mentioned. The first one is about the liver function test, LFT. It is also known as the LFT. These liver function tests are a group of the blood tests which are used to assess the health and the function of the liver. They provide the variable information about how well the liver is working and whether there is any liver damage or disease. So the liver function test is also be going to conduct if the person suffer from the hepatitis virus. So this is about the liver function test, and the next one is about the viral hepatitis serology. So the viral hepatitis serology is a group of the blood tests which are used to diagnose and identify the antibodies and antigens associated with the different type of viral hepatitis infection. So in the viral hepatitis serology, the various types of the antigens and antibodies are involved. This test helps the healthcare provider to diagnose and differentiate between the various hepatitis viruses and assess a person's immune response to the infection. So in the viral hepatitis serology, we are also going to detect about the immune response of the patient. And the last one is about the viral load measurement. Viral load measurement is also a laboratory test which are going to be used to quantify the amount of virus present in person's blood or other biological samples. This measurement is typically expressed as the viral particles such as the copies of the viral RNA or DNA, which are going to be measured in the per milliliter of blood or other specified volume. So this viral load measurement test is mainly used in order to detect the various infections such as the hepatitis infection. In hepatitis infection, I am going to specify the infection is if I'm going to specify the virus hepatitis infection, then it's a hepatitis B infection and hepatitis C infection. Okay? And this is about the viral load measurement. We are also going to diagnose the hepatitis by the ultrasound and the liver biopsy. The last slide is about the hepatitis serology test, in which this test I already discussed about it. The hepatitis serology test is mainly going to be we are going to be detect the immune response, the antigen and the antibody levels. So as you can see, if the hepatitis B's antigen, hepatitis anti HBs and anti HBC. So these are the antigens. And after that, if the patient is suspectable, then the results will be negative. If the patient is vaccinated, then the result will be negative, and like the positive, and how the result will be going to be negative. So these are the antigen tests, and this is the antibodies test, how the patient is going to be monitored and controlled. If the patient who have the past infection, then there is a negative, then the hepatitis B antigen test will be negative. So if the patient is acute infection, then the result is positive, and chronic infection, then is also the result will be the positive. So this is the result chart of the hepatitis serology test. This is this is, as you can see, this is the various conditions of the patient. If it's suspectable, vaccinated, past infection, acute infection, yeah, if the patient who have some type of the chronic infection, then the serology test is mainly performed on the on the strips, which are mostly designated about the how the patients about the which are going to be detected about the hepatitis B antigen or the some types of antibodies, etc., which are mostly relevant to the hepatitis B or hepatitis C. So this is all about the hepatitis.